In the 4 years that the Senior Alliance has been providing care transition services under the Community-Based Care Transitions Program, we've worked with over 30,000 individuals. We've been very fortunate to have had tremendous partnerships with our hospitals, as well as linkages developed through our local Care Transitions Coalition. Working with CMS under the CCTP has been a great catalyst for moving our agency into a new era.
CCTP is the first time we have honestly seen the integration of health and social services. This means that we work together on behalf of the same person and know what each other is doing. It is a huge breakthrough in terms of really looking at collaborative care on behalf of the individual.
There's just a big need for this program in general. So we just found that there's so many patients and people who just benefited from having someone to be able to see them at home and just reflect and see what things and needs that they may have that'll keep them out of the hospital.
The ability for the patient or the family to really absorb what they need to understand for effective discharge teaching is just not possible. And so I think this program has really filled that gap to really be able to go in and safely transition patients.
It's giving people hope, it's getting them education, it's getting them contacted with community resources. We've done over 7,000 visits a year, and seeing how all the hard work that we've done, the incredible results that we've achieved with this program make me so proud. I'm so proud of my team, and I can't wait to see what we do in the future.
With the whole learning collaborative approach has been a gigantic, powerful way to be able to learn from your colleagues, to give feedback about issues and then get feedback immediately about other people's successful interventions, that we've been able to make changes and shifts and pivot and correct and learn in such a compressed time frame that I've never seen before, be able to move forward and make our project successful.
As we grew our team, we had better outcomes overall, and it led to bigger enrollment. Despite this great success with growing our team, none of this would have been possible without the great partnerships that we have formed. These partnerships we consider to be our greatest success. These partnerships led to reduced readmissions, improved target enrollment, and better outcomes overall.
You know, this journey has shown that we can have a symbiotic and a synergistic relationship between the hospital partners and the community partners. If people can focus on the areas of expertise for which they are experts, the health community on health, our social community on social needs. But it doesn't have to be siloed. It has to be bridged, and it has to be considered to be integrated.
We had these services in the community and in the acute care setting, but without a formal integration and without a formal coordination of services, our patients weren't benefiting as much as they could be from the program. We have not only nurse practitioners from the acute care setting working with transition facilitators from the CBO, but we also have a constant leadership team that's been evolving the program since the beginning. With the overall coordination, this program has allowed us to have a better patient experience and for the patients in the community to experience a better transition.
Our biggest aha moment came when we saw that structuring our team according to responsibility increased efficiency.
We have team members who concentrate on introducing the program and enrolling patients in the hospitals.
And others who concentrate on coaching patients back to health once they get home.
C is for caring. We have a very caring group of people that work with us, the professionals from the registered nurses, the LPNs, and the office staff, as well as the leadership. This isn't just a job for us, it's what we love doing.
We go out into the homes, assess their needs, and are able to help them and uniquely with what they need, and also follow up with physicians' calls.
And at Sun Health, that's how we spell success.
We discovered early that a great secret of our success was a MEG. We decided every team needed a MEG. MEG is our services coordinator.
Hello. Once the coaches have identified any needs, I work to coordinate those services and get those needs fulfilled for our clients.
We also serve a really different purpose in people's lives than other people in the medical system. It wasn't that I became someone who would give her all the answers and do everything for her. It was that she was learning how to be the driver of her own medical needs.
One of the good things that we were able to do with our program was that we started noticing that there was a lot of confusion and a lot of mistakes because of the med recs that they were being sent home with. So one of the coaches got into the home of a patient, took a picture of the med rec, all of the medications that the lady was supposed to be taking. I gave that to some of the administration and managers of the hospital, and they changed all of their med recs because of that picture, and now they're much more understandable for the patients.
I've been working for CCTP for over 2 years. I have learned so much from my clients, and just knowing that I'm there for them and to help them out when they're in need really makes me feel great.
It's a pleasure to be able to be available for them and share some things with them and be a listener. I realize sometimes some people don't have anyone to talk to, so it's been a pleasure to be available for them.
You don't have to have a big story to have a big impact on a patient's life. So sometimes something as simple as helping someone with a medication management system or getting a follow-up appointment with their doctor can make a really huge difference in the life of that individual.
I want to say a special thank you to all of our community partners. It's because of your dedication, hard work, persistence, and patience that have really helped to make our partnership and this project a true success. And I think that's what's going to help us going forward in the future.
Thank you, CCTV.